Guneko, in the Medic zone of the Meta clan, is said to be the biggest village in Bengui in terms of land surface. Guneko has 4 health institutions, that is, the Munam Integrated Health Center, the Mbengagang Integrated Health Center, the Fringing Integrated Health Center, and the Open Door Medical Clinic in Jinabai. Most of these health units have been providing health care to the population for years now. Some have been on and off due to the Anglophone crisis and the management issues, while others like the Fringing Integrated Health Center have never gone operational since completion of construction works by the government of Cameroon. The people of Guneko village have their traditional leader by name Fon Fomoki. Though resident in the white man's world, precisely Germany, the Fon has a firm grip on his subjects and monitors happenings back home on daily basis. Recently, the Fon and the Guneko Cultural and Development Association (GUDECA) dispatched a team to the field to monitor the situation of healthcare provision in the entire village, with special focus on the challenges faced by the various health facilities in the village.
Ladies and gentlemen, welcome to Guneko village. Of course, it is the biggest village in Bengui Central Subdivision in Mumu Division in the northwest region of the country. In this special move, we are welcoming you as we begin a special documentary to take an overall look at the village called Guneko here in Cameroon. And of course, we shall be taking you to some major sites and projects carried out by His Royal Majesty, of course, Dr. Fomiki Waters, and a host of other elites all around the world contributing for the development of the village called Guneko. It's going to be an interesting journey as we shall take the first part of the journey, taking you over to lower Guneko and central Guneko. And on part 2, we shall be taking you to upper part of the Guneko. With me, as you see, these are the persons who will be accompanying us to realize this project. On my right, we have the chairman of the Guneko Council. Of course, is Mr. Primos. You'll be getting more from him. And that said and done, on my left, we have equally the branch president of GUDECA, Guneko Development Association. Of course, he will equally be leading us in these special operations. Stay with us on special assignment as we begin this documentary.
On Wednesday, February 3rd, 2021, the team descended to Lower Guneko, where there exists the Munam Integrated Health Center. Here, the delegation was first received by a notable of Guneko village and the Munam quarter.
I'd be happy for receive when I come for can see our Munam Integrated Health Center. It is 7 quarters inside Munam, then Sang. People from Bengang, they come down. People from Mundum, they come. That health center they work well. Then women they come born. Yeah, they feel very happy with the nurses and the chief of center.
The health center runs on solar energy, though the power produced is limited and as such can't carry some equipments. The chief of center has a better understanding of the health center, which she presented to the visiting delegation.
This Munam Integrated Center, it was open since 2008, and it was constructed in 2011. And from that time, there was a government chief of center that was sent, who ruled and left. Another one came in 2012 up to 2014. That I came and took over till date. We took over the place virtually with nothing. This is what we have achieved so far from that 2014. This is the consultation room for nurses. Where you come at any time, this is where they receive you and decide which ward you are to go. Even if it's the one that you are to go back home, the decision is being taken here. Okay. And in this health facility, we have so many activities that we carry out. We have the consultation, we have minor surgery, like wound stitching. We treat illnesses like malaria, typhoid, diarrhea, so many illnesses that we can treat. The one who cannot do, we refer to the higher level. We have a staff of 3 nurses, 2 government nurses, and 1 sent by the Cultural and Development Association that is presently working with us here. And that's the girl in place. She has been of very good use to us.
The staffing situation of the various health facilities in Guneku village has been a call for concern. To remedy the situation, the Guneku Cultural and Development Association (GUDECA) USA branch in December 2020 recruited a nurse to reduce the workload of the handful of nurses that have been at the Munam Integrated Health Center for years now. We met her in active service and she's happy with her job.
No, it's going well. At least the people are welcoming. So they are making work very easy for me.
Why did you choose and accept that offer to come to a rural area as such instead of probably the big hospitals in cities?
Yes, now getting a job in cities is not easy. So since I'm from Meta, since I was offered a job here, I decided to come since they are my people.
And you are ready that at the end of the contract that you sign, you may want to renew it?
Yes, I'll renew it.
Our tour around the Munam Integrated Health Center will then continue as the chief of center took us to the various departments that make up the health facility. At every stop, she gave explanations.
Here is a lab, and this is the person in charge of the lab. She's the microscopist. She was trained in Bangui for 10 months. Since government could not send us a lab technician, so the health facility decided to send her for training. That was 2016. Since 2016, she has been working here with us.
I'm carrying some of the lab tests, not really all because all the machines are not available. The only machine that I have here is microscope. We need more of the lab reagent. I know with the government they cannot accept us to use a biochemistry machine because it's that machine that produces most of the lab tests.
Amongst the several tests that you conduct here, what are the common illnesses many of the patients suffer from?
Typhoid, malaria, bacterial infection like STDs.
Operating during a COVID-19 period, how are you coping with sensitizing your public, especially the patients, to be versed with the COVID-19 preventive measures?
Where we sensitize them in a congregation and meeting place where we meet, we sensitize them to come for screening. Some of them come, but not all are really coming.
This is a minor surgery room that we carry out some of the operations, like stitching of wounds, dressing of wounds. And in this minor surgery, we lack some of the equipment. Like for example, this is the tap, we are struggling to repair it. That we can just be washing and doing everything. So there are broken pipes all around. You need also some money to really put in so that we can take up the project again.
So there's no water there?
Yes, if you open it, you will flood the whole of the floor. And then we like the trays to put forceps. We lack forceps to carry out dressing. These are the few that we have here. And the trays for working, these are the ones that we use. And we use what is good for us to use is the silver type that you can sterilize. And we don't have that autoclave to sterilize the equipment. And since there's no electricity here, if there's a solar autoclave that we can sterilize equipment before using, then we'll be very happy. In the surgical room also, you know, most people when they have the accident in the remote area and this time of crisis, most of them don't even pay their bills, they don't have money. So most of the things we use on them, the materials end up like that, they don't pay. So we don't know whether there can be a package for some of the material that we can keep for those that are totally poor, that cannot pay, that we can use for them. Here, this room is a mission ward. This one is for male. As you can see, in this room we have only one bed because we carry some of the beds to the outreach station in Sam.
So this Munam Integrated Health Center has an outreach station somewhere?
There is outreach station in Sam that we really need to fortify it. Because what we have to do during this month is that since people have given us a nurse, we will draw a roster that this week, this one has to go and work there. This week, this one has to work there. Because we don't want our people to suffer.
Why did you choose to establish an outreach station in Sang?
Because Sang has a population and it needs special attention for them. This is the female section of our mission. You know, in any place, women carry the highest population. That's why here you can see 2 beds. So this way when they come, we admit them until they are through their treatment before we can discharge them. Here we admit all type of patients that come to us. We don't have bedside cupboards in all the wards. And we would have loved to even have bed sheets, blanket, that when somebody comes, we dress up the bed. We should make the place look very, very comfortable for the patient to stay in. And then also inside this admission, we have problems with these Fulanis. Even the far off distance places that patient lives and come. For example, if a patient lives from Birmingham or live from Kimber, Kunga, come here. To cook food is a problem. So we need a kitchen. This is the health center main pharmacy. As you can see around the counters, very empty. Reasons being what? All money is outside. Patients come, they don't pay for their services. So we are struggling to see what we can do to collect back the money so that we can buy on the drugs and put. We take our drugs from the Norwest Special Fund. At times to reach with the drugs here is not even easy.
Many patients that pass through this health center don't pay their bills. Is it bad faith or poverty?
I don't know whether it's really poverty or what, because the way the patients always come here, the delay in the house, before reaching here, you see them in a very critical condition that you just have to rush. Maybe they're bringing somebody who is convulsing, then you just have to start treatment. After the treatment, you don't see somebody that is coming out with money. They will give you rendezvous. Let me go here, I will come, just like that. That's how the situation is. And if you refuse to attend to one, if he dies here, it will be that you have abandoned somebody.
I think it is, in this case, it is very important that you work with the steering committee of the health center and the quarter heads that are here, so that they should be able to trace out who is owing money and is not paying, because it is I would say that it is bad faith, because someone cannot save their life and they refuse to pay just a little token that have been out. So work with them, but if you work with them, it doesn't work, then you bring the matter up to us and we'll solve it.
This is the vaccination hall, we call it antenatal hall, that will receive all the pregnant women, the children for vaccine. As you can see, these benches is not even ours, it's owned by the Presbyterian Church. So we don't have benches. This is a television. This solar system does not carry this one. It's too heavy for the solar system. So we just need to replace it with a flat screen. We need a fridge, a solar fridge, so that we can store vaccines. Because the day of vaccination, it is showing that you have to rush to Mengwi, go and collect, and come. And most of the time when I want to reach out at 12, the women are waited, they are all tired. And even those ones that are coming for antenatal, I cannot program antenatal, I cannot really program outreach because vaccines are not stored. So I'm really in need of a solar fridge so that we store our vaccines. Whether there is ghost town, on the working day, a patient comes up, there is an accident, you go there, you remove a vaccine and vaccinate. The hall is there. We need benches. We need solar fridge.
Plus 20 liters.
Yes. Yeah, this is the level room. Like those dishes that I was saying, these are some of them that I found here. But as you can see, this set is only for one delivery. Okay. If we have 2 women that are in level, you will worry us with the equipment. So, as I earlier said, we need faucets to carry out, and the water system too is a problem here.
Is this bed for complicated delivery or just any ordinary delivery?
Ordinary delivery.
Within a month, about how many women pass here to deliver?
Well, it depends, because there was a month here that we even had 5 deliveries. And there are some months I will go without even one. Some we go 2 deliveries, 3 deliveries.
And you encounter cases of complicated deliveries?
Yes. Encounter postpartum hemorrhage. That's deliver, bleeding, and at times children born asphyxia, they have to undergo treatment before they are being discharged.
So how do you handle such cases? You handle them there or you refer them elsewhere?
By God's grace, we handle everything here. For the past 2 years, I've not referred. There was only one that 2020 that came with as this we call neonatal tetanus. That was trying to express in the baby. We send the baby to the nursery. From that, the rest we have been managed here. This is the maternity. The maternity section. It has 3 beds. As I told you, there are times that all the beds are full with them. But we lack bedside covers for them to put their carpet. Because when they are all in here, the whole place is just crowded. Here we need bedside cupboards. We need bed sheets that we can dress up their bed. Wow, this is the office. This is my office. As you can see, some of this equipment was supplied by the government. So we are managing it. They supply a generator that we cannot run the place because it consumes a lot. What we have here, like income, cannot even fuel the generator, and it's even bad as it's standing there. So that's why we're always depending on the solar that can help us with less charges. And this is the solar that was installed.
Still by the government?
Installed by a certain project called PBF.
Okay.
Performance-based financing. They were installed in this last December 2020.
Operating in such a rural area in crisis period, has the government been actually looking into your plight, or you are seemingly on your own?
What they do is they have a facility that will try to develop their own place. That's what they are doing now.
So there's a high need for the community and development association like Bodeka to see into the
well-being of the place. That's what government is doing now. The community need to come in with serious participation to take up the place.
Some officials like you working in such an area will tend to look for transfer to go to urban areas, but you seem to be contented working in such a remote area, Munam.
Yes, the problem, I don't even call it a problem, because you may look somewhere to go when you have problems. How many years? Since 2014, that's October that I've been here. Actually, I don't have any problem with anybody. So the place for me is welcoming, it's like my home. And when I came here, I have my plans that I put them on. I am pleading with the community that we should join together and work so that I can achieve those plans. Maybe when I will achieve the plans, then go. I like the environment, and I want us to work together to achieve a goal, so, which is the goal of to change the future of this integrated health center.
Okay.
Why not changing it to be a medicalized, that will be a doctor that will rule. Okay. So I really want that we should work and change the face so that people should not suffer going out to go and consult where. And that is why inside the crisis, when there's ghost town, I decide to come and remain here, because I don't want my people to suffer that I am not around.
Any call to patients, especially on the need to pay their hospital bills because you need that money for the sustainability of this institution?
What we are trying to do as the quarter head of this, where this health center is built, at one time, try to help us get back some of the debts that was outside, because it is really killing the place. What the people do is that when they come, as they borrow here, they don't more pass here. They go to different health centers. When the person is coming here, is come with no franc, but we will render the services. After the person gets well, he has gone with all the bills. We were even saying that sensitization should pass, because this health center is not my own.
Yeah.
It is written there on the signboard, Munam Integrated Health Center. If it's big, it's a great achievement. All what you people are struggling to is to make the place to feel fine.
And if it falls, the people of Munam will suffer.
Yes, that's why I'm saying that I really need the community. I need us to join to take up the place.
As explained earlier, in an effort to reach out to the needy population with healthcare provision, the Munam Integrated Health Center of recent established an extension unit in Sang, a neighboring community having a reasonable population. Upon our return from Munam, we made a stop at the extension unit in Sang to ascertain how the place is faring. On seat to receive us was the lone staff of the unit.
I'm the one in charge here. So I meet and I receive patients, but the difficulty that I had is just that my drugs, they are not really enough because of the crisis. We have shortage of drugs. And since it's a newly open place here in Sam and Jinsam, so it is really try to improve, because some patients they left from Bessie coming, so the Fulanis also they are coming, and even Gunono, and even here in Sam. So mostly here in Sam, and some even in Munam, and even some in Jindo. So yes, they are coming here and admitted here, and they went successfully. Except the case that I cannot handle, I refer.
About how many patients come here per working day?
The days I mostly work is on Fridays.
Okay.
Yes. So on Friday I can receive like 5 patients.
From the patients that have been coming here and the illnesses they've been suffering from, is there a need for this extension unit of the Munam Integrated Health Center to be improved upon?
Yeah, the place is really improving, because like even as they just open consultation and the admitted place for ward. So, but some women they are for ANC,
Okay.
pregnant women. So there's no place for them to deliver. So their beds they are not available. So the walking tools also they are not available. So I really need them.
For how long has this extension unit been existing?
From this February will make 9 months.
That this place has been. And within these 9 months, have there been births here? Have some women put to birth here?
So some have not yet put to birth.
Just consultations and...
Consultation and everything.
Okay.
Yes.
Do patients also come here, take drugs and then don't want to pay?
Yes, that is the most challenges that I face. So a patient will come in with the condition that you are seeing, and then the situation, I cannot let the patient go or to have anything that will hurt me. So, but when I will attend to he or she, the patient that may left, telling me that I should have all assurance to me going to market day, I'm coming back to pay your drugs. I calculate all the bills and go. But for he or she to pay in the drug, she will be paying 1,000. So the bills that are in with me, yeah, that the community is own. Yes, it's much.
Okay, madam. This is like an advice I'm giving, that it is but good that you work with the community leaders here and the quarter area so that they can quickly grab this money from the people whom you have rescued their life and give you back, right? Yeah, if you are unable to then you can extend the list to the traditional village council where the matter will be handled.
Despite these challenges that you are facing, are you still contented with the services that you're rendering? Are you still contented being a nurse?
Yes. In any situation, you have to endure.
How did you get to have this place?
It's just a place somebody offered, because even where I'm staying, it's just a place that is
Has been offered.
They have been offered because
By the community.
Yeah, by the community. Yes.
So keep on more grace here, help us, and do your possible best in whatever thing you are doing.
Do recall this expedition to Lower Guneku was carried out on Wednesday, 3rd February 2021. Having seen the reality on the ground and giving a voice to the workers and beneficiary population to express their worries, it is now time for the people of goodwill, especially Guneku's sons and daughters, in and out of the country to put their heads together and see how these worries expressed can be addressed for the betterment of the living standards of the villages. In our next series, we shall be taking you to Upper Guneku to see the situation of the Mbengadang Integrated Health Center and the Fringing Integrated Health Center. Thanks for watching.